Hello and welcome to part 2 of the iPCR training. In this section we're going to talk about full charts and BLS charts, or the treated transported by EMS. I'm not going to go over everything that we went over before. I think you have a good idea of how things operate, but I will touch on a few different pieces and review a few things just to make sure we got it. So your login, again, the same as it was with FieldBridge, first, middle initial, last name, and the password that you've set up. Again, if you're prompted to update, always select OK on that. So when we come in, we're going to create a PCR. And when the PCR opens, we're going to come to the main screen here again. And just like before, the first thing you're going to want to do is go down to the Disposition tab. And we're going to want to set the patient disposition very first thing. So for this example, we're going to choose Full Chart and hit Done. And you'll see that it's going to light up a bit more things in red than we did last time. So from here, again, if you know this information, you can fill it out here, or you can come back to this later. But you'll want to start over here at the Dispatch tab. Again, the incident number and the run call number will be the same. You'll have to enter that twice. This rest of this page functions exactly like we talked about last time, so I'm not going to cover that again. So we'll move on to patient info. And as you can see here now, in addition to the first and last name, we have date of birth, gender, address, medical history, and allergies. The medical history and allergies, when you click on that, it'll just bring up a pick list that you'll be able to choose things from that are applicable. Again, on this page, if it's not red, you don't need to worry about it. So we'll move on to the HPI, the history of present illness. On this page, again, you have your narrative there at the bottom that you'll need to complete. Again, I don't know why it doesn't light up red. That's something we're working on, but that is part of the validation criteria, so if for some reason you forget, it will remind you. But on this page, we're going to go up to complaint, and if you touch that first box there, you're going to come up with another box. You're going to hit that plus sign. And then you'll want to fill out this little box here. You have complaint type at the top there, which will bring up a pick list of a few options, as well as primary and secondary. So you'll choose the primary or secondary complaint. The complaint field there is a free type. On these patients, again, we're looking for their diagnosis, not necessarily their subjective complaint. You have a place there for duration and duration units, which would be minutes, days, weeks type thing. And then anatomical location and organ system. So once you've filled that out for your primary complaint and your secondary complaint, if applicable, go ahead and hit save. And then that'll pop up there on the right hand side where it says subjective information. Then we move on to the treatment tab. At the top there, kind of in the middle, you have your impressions, primary and secondary. You'll notice they are not red. I have not figured out how to make those mandatory fields. So for now, if you remember, that would be great. If you can't, then we'll work on making that mandatory. The back end of this is a little confusing. So if you were to click on the field there with the primary impression, you'll have a list here of impressions that are kind of generated by the state. So pick whichever is most appropriate. The next thing we're going to worry about on this tab is medications. The airway, breathing, circulation, ECG, miscellaneous, and other. We don't use those. I've taken the procedures out of this page and moved them to the supplemental info because that'll be easier for you. But when you click on the medication button, you're going to get a list of medications here. This list is not all inclusive. I will have to keep updating this as time goes on. There's a lot of critical care drugs that may not be in here. So if something's not in here, just make sure you mention it in your narrative. But when you pick something, say adenosine, it's going to come up with this box here. You're going to have performed by up there. You'll have to select whoever is performing the procedure, whether that be the flight crew or you personally. Complications is generally none. That's pre-populated, so you can leave that alone if that's applicable. Authorizing physician, you don't need to worry about. Your time there, the time it was administered. You have a prior to arrival option there. You have your route, which will be your intravenous, interosseous type thing. You have authorized by there, you don't need to worry about. Number of attempts, you don't need to worry about. Success, yes, and response improved are pre-populated. And then down at the bottom, you have your dose. Towards the left of that field, if you click on that, you can put in your numeric value, and then towards the right, you can select whether it was mils, liters, milligrams per kilogram, mics, or whatever it might be. So once you have all that in there, you can click done, and you'll want to do that for each of your medications. Next thing, we'll move over to billing. Again, the insurance info, the insurance details doesn't light up red. However, it is a required field. And when you click that, you'll be presented with this box where you'll click the plus sign again. And then you have the same box we talked about earlier. So remember, with half charts and cruise shuttles, we're putting the name of the flight program in here under insurance company, those three little dots to the right. However, if we're billing a patient's insurance, you're going to put their personal insurance information in here. You'll have to select the priority at the top, whether that's primary, secondary. The primary method of payment is going to have you select whether it's Medicare, Medicaid, basically the general group of insurance companies. And then you'll type the name of the insurance company in there under insurance company. The issuer ID is not applicable. I don't know how to get that out of there. Group name, if they have it, you don't need to worry about the insurance company's address or phone number or anything like that. And then if you were to scroll a little bit lower, you have a place for policy number and the insured's name and date of birth. It does not auto-populate in here like it does in FieldBridge, so you'll have to make sure you enter that manually. After the billing information, we move on to the supplemental information. As before, you have your aircraft and flight crew information there that's mandatory. But then we have the interventions tab. So if you are to click on that, it's going to bring up a pick list of all the procedures that we generally see. Again, this is going to be a living list. I'll have to update it periodically. If something's not on here, make sure to mention it in your narrative. But I've put in the most commonly seen things in here. So you can select as many of these as is applicable, and then when you're done, it's just going to place them in there. It's not going to ask for any more information. So next, we'll talk about how to enter vitals, which is up at the top there. You can see it circled. If you click on that, you'll bring up the vitals tab here, which is a very flashy little thing. At the top, you can select whether it was prior to arrival, the time that it occurred, who did them, the AVPU, and then the position of the patient if they were standing, sitting, or laying. And then you have your fields over here on the left, your blood pressure and pulse and respirations, SpO2, all that. Fill out as much as you can. You don't need to worry about GCSs or pain scales or anything like that. But once you've entered your values, you'll click Save, and that'll save your vitals away. So talking about signatures here, at the bottom of the disposition page, you have this authorization portion. So when you click on that, it'll bring up this little window here with the language on there that the patient can read if they so choose. And then you have some fields underneath here, such as relationship to patient, which if it's them signing, you'll select self, but you have other options there. You'll have the date there, and then the reason the patient couldn't sign. Now, that field is not free type. It'll present you a bunch of different reasons that you can choose with that. You have a couple more fields underneath that you can't see here. If the patient received privacy practices, that's checked no automatically because they get that after the fact. And then there's a piece there about valuables. Once you have all that filled out, you can hit the open area at the bottom, and it's going to bring up this page. You'll select a signature reason, and that's going to be for authorization to treat or refusal, that kind of thing. Type of person, type of representative if that's applicable. Signature status, you can say that it was signed, or you can give various reasons that it was not signed. and then the first and last name of person signing. And then in the open area in the bottom there, they can just sign it with their finger, and you hit accept, and that'll save it. We're not going to be having the flight team sign these the way we are in FieldBridge. So next thing we'll talk about is attachments. This hopefully will be a paperless system where everything can be included in the chart. So if you go up to the little paperclip there, it brings up this menu. And if you click on Form Library, you'll come up with this. And this is the PCS form. So if you push that button there, it'll bring up a digital version of our current PCS form. This will automatically populate with the patient's name, date of birth, transport date, the origin and destination. Now it'll pick where you came from and went to, which is fine. And then you have all the boxes that you would usually check on these. You also have areas like the describing the medical condition where you can free type. But you fill this out exactly the same way as you do in paper. At the bottom, if you click on the signature, it'll bring up a little signature pad and the person can sign it. So fill this out the exact way you've always been doing and then click done. The next type of attachment is going to be from the camera. So if you bring up the camera, you'll be able to take a picture of the face sheet or the patient's ID cards or whatever piece of information you like. We would at least ask for a face sheet. Once you've taken that picture, now a word of warning on pictures. When you're taking that, make sure that the lighting is good, that you can read it, that you get the whole picture so it's usable for us. At the bottom, you'll see document type. You'll tell it what kind of information it is, usually billing information if it's a face sheet, but you have other options there. And then once you've selected that, you hit done and then use over there at the left. So that should be it for your chart. Again, just as before, when you're done, you go up to review on the main page there, and you'll be able to look over it and hit submit and close, and it'll check it for validation and close call rules. It'll make sure that you want to do that because if it's good, it'll save it away and you can't get at it again. So again, if anything's missing, it's going to tell you what that is and you'll have to go back and fix it.
That's all, folks.
So pretty self-explanatory. Again, it'll just walk you through everything you need to do. I realize there's a couple fields there that aren't red that require your memory. Again, I am working to fix that as much as I can. So as always, if there's any questions, comments, or concerns, please let me know and we'll get with you on a go live date. I'm thinking probably July 15th at this point. So thanks for your time. Appreciate it.